Now this is a very interesting ECG. If you can simply pause the video and try to find out where is the problem, that would be great. So we'll begin with zooming out, zooming in the ECG. Now what we can see in here, looks very pretty interesting. What we can see here, we can try to see that QRS complex is pretty good. That QRS complex is pretty good. When we see the P wave, we can see the P wave, which is here, which is pretty well localizable. P wave is here. We can see P is here, P is here, P is here. So P waves are pretty okay. They are there and they are everywhere. So P is here, P is here. Now we see QRS is pretty good. We can see this QRS is pretty good. We have good QRS complexes. Now is the thing to see the T waves. So we can see here that when we zoom in, we can very clearly see indeed V3, not in V1, that T is inverted, means T wave is negative. So you can simply follow that this is the baseline, this is the baseline, this is the running baseline. So this is the running baseline. So here the T has dipped, so T is inverted, and it is inverted here also, it is inverted here also. So T is inverted. So when we know that QRS is positive, then we don't that means the T wave should be positive, but here the QRS is positive, the R is positive, still we have a T wave inversion or inverted T wave. You can simply follow the same thing in here. In V4 we can very clearly say that we have very good R wave, positive wave, and this is basically a T wave or inverted T wave. And this is clear cut inversion of T wave. It is not like a flat. You can simply see this is the baseline. So this baseline should have been here, but it is down or it is inverted. So whatever we think, this is not T wave. If you are thinking that this is T wave, this is not a T wave. This is not a T wave. Then otherwise this cannot mean we cannot have two T waves. This and this cannot be two T waves at all. So basically, if this positive is T wave, then this negative cannot be anything. So we only have Q, R, S, P, T. So if this positive is T, then this cannot be anything. Means we don't have anything which can be a inverted T wave. So what exactly is this then, that positive bump? Now there is only one wave that comes after T, and that is called U wave. And U wave is seen in hypokalemia, where the potassium is less. U wave is a positive wave that is seen in anterior leads, and that will be present after the T wave. That is the reason why it is called U wave, because U comes after T in alphabet. So this particular patient had a potassium level of 1.8 milliequivalent. So what are the changes of the hypokalemia? The most important changes of hypokalemia is T inversion, ST depression, and the third and the most important thing which is there with the hypokalemia is appearance of a U wave, that is after T wave. So this patient had this T inversion, which very highly suggests and is very highly associated with a positive U wave after the T, and the same pattern can be seen in all the anterior leads like in V4, V5, V6, V3, in V2 also, that there is a T wave inversion which is followed by a positive U wave, which very highly suggests of hypokalemia. So definitely, and this U wave is very uncommonly seen. So always try to remember this ECG. That's all for today, and thank you so much for your listening.